Now joining Julia on stage, please welcome Senator Roger Marshall, a physician and advocate for the Make America Healthy Again movement.
Julia, good to see you.
Thank you so much for joining
good morning.
me.
Good
yes,
morning.
I'll let you go.
We're going to share a couch?
This is perfect. We'll share a couch. It's a fireside conversation.
There we go. I feel like I'm in therapy already.
There we go. Well, we're talking about healthcare. So.
Julie, who's in the audience today? Help me out. Who am I talking to? Are these healthcare professionals or?
I think we have a mixture of healthcare professionals, advocates, people in this policy space,
okay.
Folks who are looking to, I guess, get more into the conversation on, healthcare in Washington and how it's impacting their own industries. Senator, I don't know whether to call you Senator or Dr. Marshall right now. So just to start off, so we can the audience can get to know you, what's it like being a lawmaker, but also having a background in medicine? I mean, they go hand in hand, but they're very different.
Yeah, so I practiced in rural America, delivered a baby every day for 25 years. I'm an OBGYN. I think what makes me unique up here, though, is I'm the only member of Congress that's ran a hospital as well. That a group of doctors and myself went together, formed our own rural hospital, had some success, and I also oversaw 3 county health departments. So I think I've seen this from all sides. Of course, we all train in a big med center, and we went to a big residency program. But I think it's having the practical experience. So the ACA is something that I had to implement when I was running the hospital as well as medical practices. The worst nightmare of my life, trying just to organize and taking nurses off the floor and turning them into data entry people, and seeing doctors having to spend more and more time as data entry. So I think it gives me a real perspective of what's really driving the cost of healthcare up.
Right, and speaking of ACA, obviously the conversation surrounding those subsidies and the conversation surrounding healthcare is such a central part of this shutdown right now. I know the Senate is voting later today on another stopgap, I believe, but where are we right now? I mean, I hate to ask you to play crystal ball, but how long is this going to last?
Yeah, I don't think anybody knows that. And, I don't really believe that the ACA is the real issue. I think it's really a political issue. And that Chuck Schumer got in such trouble with his base, and I don't know if it's his base or AOC's base, for not shutting the government down. They want to do something to respond to President Trump. I mean, he's had some incredible successes. The One Big Beautiful Bill, the most consequential legislation of our lifetime, perhaps as well. So he had to do something. And then they've taken this hostage, which is the COVID subsidies. And I think that's a big misconception. I know people, not many members of Congress understand the difference between the original subsidies versus these additional COVID subsidies, where we went from for the government paying 80 to 90%. The problem with the Affordable Care Act is it isn't affordable. That's the real problem here. The real problem is the cost of health care. And the friends across the aisle think they can just keep throwing money at it. If we just keep throwing money at it, regardless of what we do, premiums are going to go up 20%, right? Regardless of what we do, premiums are going to go up 20%. And then there's so much fraud being involved with these COVID subsidies. When we started having people with zero pay as having their insurance, we saw fraud go way up. So there's people out there that are making a living. All they need is a person's name and their birth date, and then they're selling them this insurance product, but the person doesn't even know it. I think like 30-some% of people on these COVID subsidies don't even use their insurance, which means they don't even know they're on it, as opposed to having to make a monthly payment. Then they would say, wait a second, where's this payment going? So we have to address the fraud, and we have to address the true problem is that the Affordable Care Act is not affordable.
So I guess how do you communicate that to Americans? Because some of the polling we've seen shows that Americans are concerned about these subsidies not being extended. They seem to maybe be siding with Democrats. How can Republicans better message what you just said?
Yeah, and I think it is very challenging because it's a very deep issue. And look, I want everybody to have health care. It's part of my MAHA, pillars is everyone have meaningful access to affordable health care as well. I think that they're asking the wrong polling questions. I think if you ask polling questions like, if you knew that these COVID subsidies, that there was $25 to $50 billion of waste, fraud, and abuse, would you suggest that we fix it? Or just keep going on as is? So I think we're asking the wrong polling questions, but it's very hard to message because it's a complex topic.
I want to switch gears and talk about Make America Healthy Again, that initiative. I know you penned an op-ed in The Hill earlier this year leading up to Kennedy's confirmation in the Senate. Talk about how the progress MAHA has made, 8 months in?
Yeah. Well, it's we're on Trump time now, so it's not fast enough. It's very hard to move this needle around. You think about America. You want me to drive down the cost of health care, we have to address America's health. 70% of Americans have a chronic disease right now. 20% of our children are on a prescription drug. 30% of our children are obese. 40% of our children have a chronic medical problem. So it's very, very hard to turn around the health of America. So what I've tried to focus on is 4 pillars. Secretary Kennedy is doing what he can through executive order, and then I'm working on a legislative package to address these pillars. So my 4 pillars are number 1 is precision agriculture and healthy soil. And then number 2 would be food as medicine. Number 3 is meaningful access to affordable primary care. And then number 4, address the mental illness and the neurodegenerative disease of our children as well. So we have packages of legislation. It won't be simple to get those through. So it's not going quick enough. I think that the first MAHA report maybe missed the mark a little bit. Okay. I think the second report was a little bit better. And I think most importantly is Secretary Kennedy and the MAHA group and agriculture now on the same page, okay? And what I think is healthy soils where agriculture meets MAHA. So rather than telling our farmers what we can't do, tell them this is our goal. Our goal is healthy soil, and with proper precision agriculture, we can use 50% less fertilizers and chemicals, and we can decrease the drift of those chemicals from the field by 90%.
Right.
And therefore less toxins in the water. So we're getting there. We're getting there. We got a long ways to go.
Yeah, and I think there's a fair number of voters, I've talked to them, who think all of those initiatives are great. They like the removal of artificial food dyes, for example, from food, all of that. But when they look at MAHA, I think a central theme they see or something that sticks out is Secretary Kennedy's past remarks on vaccines and questions about vaccines going forward. What would you say to those Americans who are maybe, they like some things about MAHA, but vaccine skepticism, that just sticks out to them?
Yeah, that's a tough one. And, the sad thing is Congress has spent 95% of our time this quarter, I've got like a quarter of school, working on vaccines. Look, vaccines are 1/10 of 1/100% of what we should be working on from a MAHA concept. So it's too bad that we've let that sideline us. I'm very much of the opinion of valuing the patient-physician relationship and informing patients, the pros and cons. And we don't need to dive down there. But this vaccine skepticism was actually created by Dr. Fauci when he lied to America about the mRNA vaccines and what it would and wouldn't do as well. So I think we're still, and they lied about the origin of the virus, all these types of things. So we're inheriting that. We're inheriting this vaccine skepticism. And this is, it's just, I don't know why, but people are just obsessed with it. But I'm so ready to move on and let parents decide with their doctors what's best for their children.
And I think just, there's a lot of confusion among Americans right now because there is information overload, whether it is from the government, from lawmakers, from social media, from, the news media. I mean, a few weeks ago, we had this nationwide conversation about pregnant women taking Tylenol. We talk about vaccines, et cetera. What's your advice to Americans who don't know where to get healthcare information? They don't necessarily know who to trust because there's a lot of conflicting opinions.
Yeah, how about your doctor? I don't understand what the confusion is. I know your history. I know what you're high risk for, what you're doing, your social history as well. And let's make a decision together on this hepatitis vaccine for your child as well. So I think your doctor, the nurses typically do a really good job as well. And you're right, there's just too much information out there, and everybody overreacts to one study. If I overreacted to every study I saw that something, coffee causes cancer, wine causes cancer, no, wine's good for you, no, wine's bad for you. So, just quit. You quit it. Take it all with a grain of salt and ask your doctor.
That's so interesting because someone told me that Sauvignon Blanc has less sugar than red wine, and I thought red wine was the healthier one. Well, I digress. Vice President Vance echoed that point. He said, talk to your doctor. Do you sometimes wish that President Trump and Secretary Kennedy would say, talk to your doctor, prioritize that?
Gosh, it's hard to decipher everything they've said or not said. I assume they've said that before, but I can't. I don't remember
I see.
Okay.
Let's dive into women's health here and, maybe how MAHA could impact women's health. What are some of the initiatives on that front? I know you're an OBGYN, so just wanted to get your perspective there.
Well, as we see what's driving maternal mortality, let's start there. When I was in med school and residency, the drivers of maternal mortality were strokes and infection, hemorrhaging, complications from anesthesia. So when I came to Congress, oh my gosh, Bernie Sanders says, how come maternal mortality is going up? And I cited the things I just cited. But I said, I haven't seen a really good study in a long time to really figure out why we're having this spike. So we passed legislation to fund a study. And guess what it showed? And we had experts in front of HELP, and I'm asking them the same question. What's the number one cause of maternal mortality? When you measure maternal mortality, you go for the year after having the baby. Guess what the number one cause of maternal mortality is now? So it's suicide and fentanyl overdose. So what that means to me is after this patient's delivered, the delivery's not over with. I mean, we have to hang on to that patient and figure out what's going on in their personal life. As well. And certainly there's risk factors, and let me get too quirky on here and go too deep, but I think that would be one thing. The other thing that's exploded, of course, is diabetes of pregnancy. You want to know why our C-section rate is going up. In addition to malpractice issues, it's obesity. I just dedicate one day a week to doing nothing but taking care of having a diabetic clinic I would typically see 40 to 60 patients every day, but one of those days was just for my diabetics.
Wow.
And of course, those turn into type 2 diabetics later, et cetera. So I think, the MAHA thing, there's nothing magical. We need to execute a simple plan well. So it goes back to nutrition. Give me a healthy mom with good nutrition before she gets pregnant, and I'm going to celebrate. I mean, that's all I ask for is a healthy mom. But when they come in with type 2 diabetes, all your risk of complications double and triple. So I think it's simple things like that. I would start there.
Right, and forgive me, I'm not a doctor, so when you talk about diabetes and link it to MAHA, you're talking about maybe the processed sugars, the added sugars into food. That could be a contributing factor there.
Yeah, all the above. Certainly 70% of America's calories are ultra-processed food. I challenge everybody to spend a week and don't open a sack or a box. Okay, just try it. And so 70% of our calories are ultra-processed. It's the sugar and the salt as well. But it's all linked to the type 2. The diabetes of pregnancy is certainly linked to obesity. But then for some women, they have a genetic predisposition to it as well. And I won't bore you on the insulin receptor business here. But so you throw in a pregnancy and hormones, and they start off overweight, they're just walking into to diabetes of pregnancy. It's called A2 diabetic.
I feel like recently when talking about healthcare, and we only have a few minutes left, one topic of conversation that comes up, I think nationally and especially among women, it seems, is patient advocacy. I hear this message, advocate for yourself with your doctor. Talk about that. It seems that it kind of ties into this theme of having a trusting relationship with your doctor. Wanted to get your thoughts on that.
Well, that's a tough one. I don't understand it. I mean, that's why I wanted to be a doctor, is to have a relationship with you. And now people want drive-through medicine, just like they have drive-through fast food, and it doesn't work. My wife has an asthma problem. I'm a senator. It took me 6 weeks for her to get into a doctor up here, and she ends up seeing a PA. I mean, with all due respect, the reason we chose a pulmonologist and not a primary care doctor is because she has a very significant asthma problem. I want a doctor that's went to 4 years of medical school, did 4 years of residency, has seen 100 asthma patients this week, not a PA. So we went through this drive-through medicine, urgent cares and ER visits, and frankly, I don't understand today's medical students and new residents why. I mean, they want to work 30 hours a week. Like, come on. That's not why we signed up for this. I worked 100 hours a week my whole life. That's just who I am. So I'm baffled by that as well. But I think you're onto something, that it is the relationship part of this. But by the way, I could link this back to the only people whose healthcare costs aren't going up are people employed that are self-payment model, self-insured, and direct primary care. where this one doctor and his team of PAs and nurse practitioners are managing these 200 patients that are employed here, or 2,000, whatever it is. And the secret there, though, is that relationship. So that when someone calls me up and says, this is what's going on, I know you. Like, okay, you're having chest pain, you're a farmer, and you don't want to get off the tractor. My gosh, you're having a heart attack. Get your butt in here. So you have to know the patient, like who you need to coach up. Yeah, anyway.
Senator Marshall, I could talk politics and medicine with you all day. Unfortunately, our time is up, but thank you so
You're
much
welcome.
for taking the time to sit down with
Good to see
us.
everybody. Thank you.
you.